Today at the COMy myeloma meeting in 2019 in France, I talked about patient perspectives and how we incorporate patient perspectives in myeloma care. There are three aspects that I tried to focus on. Number one, why should we take patient perspectives? Number two, how well do we do it now? And number three, how better can we do this for our patients? So clearly, patients can be involved in multiple different areas within their care. One of that is patient-reported outcomes. That's very well set within clinical trials, but how do we actually do patient-reported outcomes in routine practice is something that I touched upon today. The second aspect is around research priority setting, and certainly within plasma cell dyscrasias, so this is not just myeloma, but also smoldering myeloma, and in MGUS, there's plenty of research going on. How do we actually engage patients to help us ask the right questions for them is an area that patient perspective can be very helpful. Clearly, myeloma is moving to a more chronic disease with long-term survivors. So how best we follow up patients in the longer term is also an important area that we need patient perspectives on. We now have a number of monitoring tools to monitor our patients as to how well they're doing with their myeloma, and how best we do that. Can we use more remote monitoring for their patients, and how do we apply these tools on a regular basis is something that we need patient perspectives on. So essentially, I elaborated on all these areas to say that we do lack significant amount of data in a patient perspective in guiding how we care for our patients and how best we research for our patients. And I gave a couple of examples of large data that's available in the UK which help us guide. One is the RUDY data from Oxford, which is generating data on myeloma patients. And the second is the Haematology Malignancy Research Network data up in University of York, who have collected data over 15 years. And all of this data is on file. I think we can use this to try and understand how our patients are doing through routine care. And the other concept that I introduced is being able to use patient-reported outcomes during routine care for myeloma patients and how that could improve their quality of life. And we're in the process of setting up a clinical trial, and I went over the design of the study, and I hope in future meetings to present that. And all of this clearly was well received by colleagues, and clearly there's an interest in developing more patient focused work, but clearly further steps have to be taken by different cooperative groups for us to best meet this.